right, so Leigh, tell us about where you work and what you do.
So I work here at UHS hospitals. I'm the System Director of Pharmacy. So I have oversight to provide strategy and vision and a strategic plan for all areas of pharmacy. So our inpatient pharmacy, our outpatient pharmacies, our specialty pharmacy, the pharmacists who work in AM care and the emergency room and transitions of care. So all of those buckets kind of fall under system pharmacy.
Great. And could you tell us a little bit about how you got to where you are today?
So do you want education-wise or?
Sure, yeah.
So, I started off going to Albany College of Pharmacy. I graduated in 1987 with a bachelor's degree because that was the degree at the time. And then I moved to Long Island, and I think one of the best things I ever did was I worked for 5 years as a bench pharmacist in a small 200-bed community hospital. So you did everything. Right, you filled cassettes, you made IVs, you did chemo, you did TPN, you went to the stock room and got cases of D5W and brought them back, and you worked every shift. So, and this was back at a time when I worked the evening shift, I worked it alone. I didn't have a tech, I didn't have anybody. And so I learned very quickly how to triage, how to make decisions. I learned that nurses are my best friends. I learned how to communicate with doctors, for big issues and little ones. First rule, right, is never let a crisis go unused. So I learned that really easily. So I think that was super, super helpful to my career because as a leader, sometimes you're making decisions, and it's nice to know that I'm making decisions about something that I'm aware of. I've done a lot of that before, so I think I can bring some empathy and experience to what I'm asking people to do. But I also learned within that 5 years that I had kind of maxed out that bachelor's degree, and that if I wanted to do anything else for the rest of my life, I was going to have to go back to school. And that had always been kind of my goal. I had written down early on that I wanted to get my PharmD by the time I was 30. And so I looked at the programs that were available, and St. John's had a 2-year post-bac program. So I applied and got into that program and finished like 5 days before my 30th birthday. So it actually worked out really well, and had great experience at St. John's. Again, worked in big hospitals, community hospitals, worked in county hospitals. So you got to see this really disparate group of patients. But again, you learn every opportunity that you have, and I think that was something else that's important is I took experiences that scared me a little bit. Mm-hmm. Right, I had to take a rotation in pediatrics, and it scared the living daylights out of me. But it was something that was important that I do and that I learned from that.
Great. So tell us what made you decide to make the Triple Cities your personal and professional home.
So, very interesting story. It's kind of like the conclusion of a circle. So I grew up about an hour, northeast of here, up in a town called Lawrence, New York, which is right outside of Oneonta. So my dad worked in the post office here in Binghamton when I was growing up. So I went to school in Albany, and I had moved down to Long Island, and I took advantage of all the things that had to offer me. So we lived, my husband and I lived in Long Island, we lived in New York, in the city, we lived in Queens. But I had to, I was lucky, I had to take chances, I had to take jobs that were away from home. I had to go where the jobs were because not all jobs for administrative to be able to run pharmacy programs were in my backyard. So I had to travel to, I lived in Long Island, I lived in Chicago, I've done some work in Michigan. So I'm very fortunate that I was able to do that, but that was also something I think was really important, that I was able to kind of take that risk. And and it's scary to pick up everything that you own and move to Chicago, where you don't know literally anybody. But I did it, and it was a great experience. And then COVID happened, right? And so a lot of things happened, and a lot of programs shut down. And so I found myself back home, in my home up in Lawrence, New York, which is, my family home. And we never let it go. We still own it. And so, fortune being what it is, this position opened up very shortly after I moved back. And, I know people who work here, so I picked up the phone and made some phone calls, and found myself here very shortly thereafter.
Great. So tell us about why you decided to run for president of the American Society of Health System Pharmacists.
So, I think that you talked about professional home. So ASHP has been my professional home, obviously, for a number of years. And I think so much you don't choose to run for ASHP. I think it kind of happens the other way around. You're kind of chosen by the energy and the organization itself. It kind of gets woven into your personal tapestry. But I started out being involved in my professional organizations as a young practitioner down in Long Island, where in my local organization needed people to step up and take on some roles and volunteer. And so I did that. I stepped up. I said yes, not really knowing what I was saying yes to. But I fell in love with the energy. I fell in love with the ability to make an impact and to empower other pharmacists and to be a voice and to advocate and all of that. Just really, it was just an amazing thing, and the people that you meet along the way. So my activities at Long Island led to activities in New York State, and I was very active on the board of directors for New York State for 10 years and became a presidential officer. And then the same thing happened with ASHP. So now I'm representing New York State at ASHP. And again, now you're meeting all of these amazing people, and you all have that same calling, right? You all have that same passion, that same purpose. And so it's easy to get caught up in it when you're all feeling the same things. And so it was just the momentum. And I remember very distinctly looking at one of my friends, Chris Jalowski, who was a past president of ASHP, and I was in a meeting and she was up on stage, and I was just looking at her and being amazed at what you're able to do, right, as president of ASHP. And someone walked behind me and said, that could be you one day. And it was the first time I ever really thought that could really happen. And so when the time is right, and timing has to be, there is a timing component, I think. There was a call out for the board of directors. And the first time I put my name in for the board of directors, I did not win. The second time, actually, I was not slated the first time. That's right. The first time I put my name in, I was not slated. The second year, I was slated and did not win. And then I was not slated again. And then the third time, the fourth time now, I was slated and I won. And again, timing being everything, I was slated with other people, and I won the year that my counterpart on the board won, Jamie Sinclair from Iowa. And so we were able to do this together, which was a fabulous, fabulous thing. And then COVID happened, right? And so now we are leading this 60,000 member organization through COVID. And obviously medication use, all of the things that were going on with how to treat a disease that we don't know anything about. It was one of the most challenging times in my life, but also probably one of the best times in my life to have people say, I look forward to that news link from ASHP coming in every day because I know it's going to have something in there that I need. And so to be able to have been part of making people feel comfortable about their roles as pharmacists and technicians and students. Certainly the role that we had as immunizers, still one of the proudest things that I will ever do. Is spearheading the role of pharmacists as immunizers to combat COVID. And then finally, so your term on the board ends and you have two choices. You go off gracefully into the sunset, or you throw your name in for president. And so I threw my name in and was slated for president, and then I won.
So what does it mean to be a trailblazer to represent women in healthcare?
It's funny. It's like I don't think of myself as a trailblazer. I think of myself as a pharmacist who loves what I do, who sees a need, who loves to have a voice and be the voice, and want to share the joy of being a pharmacist and all the things that we do with other people. So if that makes me a trailblazer, then it's awesome to be a trailblazer. I love it.
So what do you feel like are the most important issues facing pharmacists and pharmacy learners today?
There are so many things, right? So we have the appearance of pharmacy deserts, and in a rural New York State, that's happening. We're seeing chain pharmacies close pretty much on a weekly basis now. So that puts pressure on those of us that are still here. to be able to make sure that we're providing care. I think that the decrease in enrollment in pharmacy schools is something that scares me a little bit. Not just because it's something that I love, and I think that perhaps it's just not it's not getting its due. There's a small number of negative voices that are not happy within the profession, but those numbers, I believe, are small. And I think there are more people out there like me who, find a great deal of joy and excitement about what we do every day. We just have to do a better job of talking about it. So I think it's more of a marketing problem than it is anything, and we're actually working on that at ASHP. So I think that, those are things. And then finally, I think just trying to find out where pharmacists are going to land, or where we're going to find our footing in the provision of healthcare. So we know that there are not enough primary care providers, and we know that pharmacists can in fact provide a level of primary care. Just saw an article yesterday that said if pharmacists were allowed to be active and prescribe for the treatment of hypertension, they could save $11 trillion a year across the country. $11 trillion a year. So, I know that some people are not comfortable with that, but I don't think that we have time to continue to make sure that everybody's comfortable with it. I think that we just have to go. We just have to do it.
And what can preceptors and pharmacy learners do to get involved and make an impact within professional pharmacy organizations?
In a way, I'm going to say that that's easy, right? It's say yes. Okay, so we have an opportunity to go to monthly meetings, to be involved in our local organization, and that's where it starts, right? All politics is local, right? All professionalism is local, so you start there. And just by being involved and seeing, when we go to our local meetings and I see 50, 60, 75 people in a room, it's awesome, right? So take that and realize that your voice counts, your voice matters. And you can use your organization as a platform to talk to legislators, to people who are making regulation, to promulgate change, because that's how change happens. It doesn't. Nobody ever knocked on my door and said, hey Leigh, what do we need to do to make your life as a pharmacist easier? Right? That never happened. It was always me banging down their door, telling them what needed to change. And that's what you have to do, is you have to build that voice, create the confidence, and make the change.
Great. Is there anything else you want folks to know that I haven't asked you?
You know what? I love being a pharmacist.